Let's get started. Thank you for joining me. My name is Dr. Garcia Webb. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And what does that mean? It means I see patients for their weight regularly. I prescribe these medications all the time. I love to talk about them, and I'm here to help you too. So we're going to talk about some questions that you all had about weight medications, and if you have questions afterwards, feel free to leave them in the comments, and I'm happy to answer them in the next live. So let's get started. And also, if you want to work with me directly, whether you're in Massachusetts or outside of Massachusetts, there's a link to my website, and you can definitely click on that, and it'll give you all information. All right, so this is a question about Mounjaro and blood pressure. I'm going to change this question a little bit because I can't answer personal medical questions, but I will answer this to the best of my ability. So, can Mounjaro cause extreme low blood pressure if somebody's been on it for 4 weeks? Let's say if somebody noticed that their blood pressure was dropping more and they had a higher heart rate. So I will say that there is some evidence that the GLP-1 agonists can increase, they can cause some very mild tachycardia. I have not really seen this much practically in the clinic, but theoretically they can. But still, overall, I would say much better for a cardiac profile than something like phentermine. I wouldn't really expect a significant increase in blood pressure, a significant increase in heart rate. But if you are really dehydrated on the medication, if you're not eating much, if it's hard to keep fluids down, if you're having vomiting or diarrhea, that could most definitely drop somebody's blood pressure and increase their heart rate. So somebody who's dehydrated is going to have that low blood pressure, high heart rate normally. That's the body's way of compensating if it's just not sensing that fluids are getting where they need to go. So that could certainly be a part of it if somebody notices their blood pressure is dropping. I will say if somebody's noticing more subtle decreases in blood pressure, or not subtle, I mean, a lot of times when people lose weight and they're on a blood pressure medication, they don't need as much of it anymore. Or sometimes we can just get rid of it entirely, which is a great case, I think, for using these medications, is that yes, you are adding a medication, but you are also welcoming the possibility of maybe not needing other medications in the future. So certainly if somebody was on a blood pressure medication, they start taking something like Mounjaro, they're losing weight, even 5% body weight loss can impact your blood pressure. They notice their blood pressure is dropping, or they can go down to maybe half of their blood pressure medication. Again, talk to your physician who's coordinating all this for you, but that's definitely within the realm of possibility. Great question. Next question, would you ever prescribe a GLP-1 agonist to someone who doesn't have the food noise issue? For example, someone who is eating clean, exercising all the time, weight training, but the weight just isn't coming off. Yeah, absolutely. It's not a prerequisite that you have food noise, and I would argue that this would be a perfect candidate. Somebody, again, just a generalization, not talking to somebody in particular, but somebody who's eating how they want to eat, exercising how they want to exercise, all those things are dialed in, but they are not seeing the healthy changes that they would expect to see or maybe saw in the past. That's certainly somebody that would be a very appropriate candidate for weight medication, all things considered. So you don't have to have the food noise, and some people don't. Some people just are doing all the right things and the weight just doesn't come off. And that's always, if they meet the right criteria, usually that is someone that really could benefit from the medication. And yeah, so definitely not a prerequisite. And people who do have food noise, of course, sometimes it helps a lot. It really depends on the person, but a lot of people find that it is extremely helpful for that kind of food awareness that's on hyperdrive for some people. Okay, next question. Have you noticed that the drug becomes less effective over time? I've lost 40 pounds in the last year on Wegovy, but weight loss has stalled now. Okay, so not going to answer this personal medical question, but I think we can extrapolate from that. And I did a video on this on my YouTube channel a little while ago about if, your weight medication has failed you. Because I think what is important to keep in mind for people, like ideally this is what happens when you start the medication. It's like great, and then you reach your new normal, and then it's just kind of maintenance. So there's a very dramatic change, but after a while there's, that evens out, and so you don't have that dramatic change over time. It's just maintenance. You're on the medication for the most part just to maintain that weight loss that has occurred over this shorter window of time. So I think it's good to just mentally prepare yourself for that there will be maybe a more exciting period, and then like everything else that is healthy for us, probably kind of boring. But that's the goal. The goal is always to be, medically boring. And so it's not that it becomes less effective over time for people on the whole, but that you reach that new normal, and then your weight's not really going to change anymore if you keep everything the same. Now, of course, people can add things, they can make lifestyle changes, they can add medications, all those can happen too. But yeah, usually you will reach a new maintenance weight, which is great. Okay, weight loss has stalled. So that could certainly be going on. I think it's also really good to, if you feel like, some people find their maintenance weight and then they start to regain a little bit. And that's always a good time to just check in and see, has anything else changed? Have I started a new medication? Have I started something like gabapentin? Have I started something like, Zyprexa or something, these Paxil, these medications that we know can really fight with a GLP-1 agonist. Have I started a new medication? Have I changed anything in terms of my eating or my exercise? A lot of times we can make these changes and then get to where we want to be weight-wise, and then kind of forget that we made them. And if we're not vigilant, it's very easy, especially in the first couple months, to just kind of revert to old habits. So you want to just check in and see, is there anything that I'm doing that I wasn't doing before when I was losing weight? Has anything else changed? Am I exercising as much as I was? Are my eating habits the same? And get pretty granular, because you want data on yourself. And whether or not things have changed, doesn't have to mean anything terrible or horrible. It just means this is good data to have. If something has changed, that's a great place to start if you want to make new changes. Or if it hasn't changed, then definitely circle back with your doctor who's prescribing the medication. Yeah, great question. Okay, so if I am getting a better price with Zepbound than Ozempic, can I switch? You can absolutely switch between the GLP-1 agonists. It's not always a clear one-to-one correlation. So you talk to your physician, but all things being equal, and you could access the other medication the same as you could, and you're getting it at a better price, and all that is working in your favor, you can definitely change. And you don't necessarily have to start at the, let's say you were on Ozempic 2, and then, this is theoretical, of course, let's say you were on 2 milligrams of Ozempic, you got a better price with Zepbound, you wanted to switch. Well, 2 milligrams of Ozempic is the maximum dose on Ozempic, and the maximum dose on Zepbound is 15 milligrams per week. So usually I won't start somebody at 15, because I want, there is some variability on how people are going to tolerate the medication. So I'll usually change somebody over to the 10 of Zepbound, see how they do on that, and then move them up gradually to the 15 if they're tolerating everything. Well, you know, if you're on the starting dose of Ozempic, you could just switch over to the starting dose of Zepbound. So it depends a little on where you're coming from, but you can absolutely switch, and it's not really a big deal at all. I just go down a little bit just to anticipate that there might be some more side effects with the change. What about the older medications like Qsymia or phentermine? Do they work as well as the other ones? Do they have side effects? Yes, they do. They absolutely do. I think this person is getting at, you know, alternatives given, this is a longer question, given the lack of availability with the GLP-1 agonists. So yes, they definitely work. They definitely, you know, statistically don't work as well. So for something like Ozempic, you're looking at probably, or Wegovy, you're looking at probably about, you know, 12 to 15% total body weight loss. And for Zepbound or Mounjaro, you're looking at, you know, maybe close to 15%, maybe 20%. So that's very different than phentermine, where average is usually about 5%. Qsymia is like 5 to 7%. So you're not, it's definitely not statistically the same, but you certainly can see great results. And every once in a while, I do have a patient that loses a lot more weight than I would have anticipated on one of these. And they're also great to use if we, like if I need to augment weight loss, or not need, but if the patient will, like, let's say that, you know, they're on Zepbound and they went from a BMI of 37 to a BMI of 32, and you know, they feel that they want to lose more weight and they're still having trouble, and they've made all the lifestyle changes that they want to make. That might be a place where we could add something like phentermine or Qsymia, which is phentermine and topiramate, or just the topiramate. So it really depends on the person, but you can certainly add them to the GLP-1 agonists if it's an appropriate situation. So they definitely work, and they are a lot more available in terms of pricing, because they are usually generic, or if they're not, you know, some like Qsymia is not generic, but it's made up of 2 generic medications, so you can kind of like, you know, prescribe both at the same time and get a very similar effect. So much more accessible in terms of price. I think probably with the availability shortages of the GLP-1 agonists, there, like, I know there have been phentermine shortages around where I am, so that's definitely a kind of trickle down to the oral medications. But I think there are, you know, multiple manufacturers of these medications, so that also helps with supply as well, because they are generic. So you can definitely explore that. Would definitely talk to your physician, see if they're an appropriate fit for you, and yeah, they can be a great tool for people. Okay. So that is going to do it for today. Thank you so much for joining me. If you have questions afterwards, please leave them in the comments, and I'll post this on my YouTube page afterwards. And I always appreciate the questions. You guys have great questions, and please be well.